Okay, guys, discussion B deals with common mental health myths that baby boomers grew up with. Ideas shaped by a time when emotional expression was discouraged, therapy was stigmatized, and mental toughness was treated as the cure for everything. Each side highlights one myth and one contrast it with what modern modern science now understands. The specific slide you're viewing focuses on the myth. You just need to tough it out. What this myth meant historically. Boomers came of age in an era where endurance and stoicism were praised. Emotional expression was often labeled as weakness. Mental health struggles were expected to be handled privately. Seeking help was stigmatized or seen as a personal failure. The cultural message was push through, don't talk about it, don't ask for help. What the article says science now shows. The page explains that suppressing emotions isn't strength, it's harmful. Modern researchers links emotional suppression to higher stress levels, increased risk of anxiety and depression, physical health consequences, e.g., hypertension, immune strain, difficulty forming supportive relationships. In other words, toughing it out doesn't resolve distress, it blurs it. And the blurred stress shows up elsewhere. How this fits into the larger article. Although you're only seeing one slide, the full piece lists 12 myths. Boomers may still believe the theme across them is consistent. Outdated beliefs about mental health, cultural norms that discouraged vulnerability, new scientific evidence that contradicts those norms. This slide is one example of how the article contrasts old expectations with current psychological understanding. Why this matters for your work. Given your focus on myth busting, caregiver education, and generational communication, this slide is perfect illustration of how long-held beliefs shape behaviors in families. Older adults may minimize their own distress. Caregivers often misinterpret stoicism as resilience rather than unspoken suffering. Updating these myths can open doors to healthier conversations. It's a clean, relatable example you could easily fold into a handout or podcast segment about why emotional expression is not weakness but a healthy, productive behavior. Okay, here's the second part, guys. The piece lays out 13 specific mental health concepts that many baby boomers still misunderstand, not because they're unwilling to care, but because they were raised in a cultural environment where stoicism was a virtue. Emotional struggles were memorialized. Therapy was stigmatized. Productivity was equated with worth. Boundaries were seen as disrespectful. Trauma was narrowly defined. The article contrasts these older beliefs with current specific understanding, showing how these misunderstandings create generational tension and prevent healthier conversations about mental health and well-being. The core idea behind the text, the headline, 13 things boomers just don't get about mental health, isn't about blaming boomers. It's about highlighting how outdated frameworks still shape their reactions to anxiety, therapy, boundaries, burnout, trauma, and healing. The surrounding page content explains that boomers often see mental illness as a character flaw rather than a medical condition. treat therapy as something for crises rather than growth. Misinterpret anxiety as simple worry. View meditation as weakness. Believe burnout is just tiredness. Underestimate emotional intelligence. Think trauma must be dramatic to be real. Treat rest as laziness. Interpret boundaries as rejection. See crying as fragility. Dismiss self diagnosis as attention seeking. Believing happiness is the goal rather than emotional authenticity. Expect healing to follow timeline. Each point is framed as a myth rooted in generational norms, followed by a science-based correction. What the article is really doing. It's offering a gentle generational critique. Boomers aren't wrong, but they were shaped by a world that didn't have the language, research, or cultural permission we have today. The author argues that younger generations treat mental health as essential, not optional. Science now validates what was once dismissed as weakness. Emotional literacy is a skill, not a personality trait. Healing is non-linear and deeply personal. The tone is firm but empathetic, inviting boomers to update their mental health lens rather than shaming them. Why this matters for your work. The article is basically a ready-made myth-busting framework for the kind of family-centered, dignity-focused education you create. It gives you clear generational misunderstandings, evidence-based corrections, language that bridges empathy and accountability. Real-world examples of how stigma shows up in families. You could easily turn this into a podcast segment on why your parents think you're overreaching, a handout for caregivers on reframing outdated beliefs, a workshop session or section on generational communication, a myth versus fact sheet for families navigating mental health conversations. Okay, guys, that is your B for this afternoon. I will be on later for show. See, give me a bit, please, and I'll be back on with that for you a little bit later. For now, Gator Wellness. Take care, folks.